My name is Heather Asbury. I have been in the dental industry for about 10 years now. Started and have a lot of background in marketing and dental consulting. There's something about kind of finding that puzzle piece to find associates to join practices teams and being able to use my skill set to facilitate and assist in making those connections has really been rewarding for me. The first thing that we would do if a client came to us looking for an associate is really get to know them, find out exactly what they're looking for in an associate, find out what specific skill set they're looking for, and really get to know their environment and their culture at their practice so that we can really work towards creating a comprehensive profile and marketing plan. All of this really helps me and our team highlight that opportunity in the marketplace and highlight what's going to be attractive to candidates about this opportunity and make sure that we are getting it as visible as possible throughout that marketplace. So a lot of different things that we check with or talk with, but we then get to work. We use our network, our engine behind DDSmatch, and try to find as many matches or good candidate matches that we can. So in my opinion, an associate position is an important step on a doctor's path to ownership, especially the younger doctors coming out of schools or residency programs. They don't have any experience in a real live running practice yet, or typically. And so they can really, even a short-term associate position will help them gain that experience, help them learn from the good and the bad of running a live practice. And it's also a chance for them to build up their hand speed, their procedure knowledge. A lot of associate positions include invaluable mentorship from the owner doctors or some of the other older associate doctors. So I think it's a great step on their path to then transition into ownership. Yes. Definitely, I advise them to be as open as they can be to different types of associate positions, to different locations. It definitely increases the pool of opportunities, of options for them. And be prepared to be interviewed by an owner doctor or a practice, but also to be prepared to interview them, to have a list of questions to ask them, to make sure that the practice you're having these initial calls with is also going to be a good fit for them. So oftentimes it's a struggle to find out the exact right timing to add an associate for a practice, but we do have a couple of commonly looked at aspects. The first one being space. So is there enough space at the practice to facilitate adding a doctor? Are there enough operatories where a doctor has enough space to come in and work? We also look at scheduling. How far out is the practice booking their patients? Because there's a big difference between patients being booked out 2 weeks versus 8 weeks. And the further out we're booking our patients, the higher the risk that that practice could be losing some of those patients. So is it time then to bring in an associate to assist in that scheduling? And financially, we need to make sure that the practice can handle supporting an additional dentist, keeping in mind that as associate dentists ramp up, adjust to the practice, there is often a dip in the income during that initial time frame, and just making sure that the practice is aware of that. So there are a lot of different benefits a great associate can add to a practice. Definitely it can bolster collections. Active patient counts can go up as we're bringing in new patients. Certainly offers some great scheduling flexibility. The owner doctor might be able to take some additional time off, a lot less stress when dealing with scheduling coverage issues. So that associate can certainly assist with that. So a lot of different reasons that it's a healthy choice for a practice to add an associate when they're ready and when it's the right time. DDSmatch has placed hundreds of associates. And as I have started specializing in associate placements, every placement that is considered one that we've found, I consider a success story. The process of finding that piece to complete a puzzle is very rewarding and gratifying, not only to the owner doctor, to the practice, but to the associate that's taking that position, but also to me, to myself, and to DDSmatch.